Nice presentation. So can we have the next speaker, please, Dr. Pragya?
Good morning, everyone, respected judges. I'm Dr. Pragya Bhattacharjee, and I will be presenting on HELVESTON syndrome, its patient-tailored management, a case series. As we all know, HELVESTON syndrome or the triad exotropia is a rare set of intriguing set of strabismic conditions that manifest as dissociated vertical deviation, overaction of superior obliques, and a pattern of exotropia. In this paper, I will be reporting 4 such rare cases of HELVESTON syndrome who attended our strabismus OPD, who were surgically operated with a successful post-operative outcome. Now, there could be a variable permutation of surgeries to choose from, but to pick on only one set of surgical procedures become extremely challenging pertaining to the variable extent of the presentation, the unpredictable outcomes of the surgery, and the multi-stage surgical procedures. Like one key does not fit all locks, likewise, the management of HELVESTON entails an individual-oriented management. It is a prospective study of 4 patients. They were thoroughly evaluated as per our Squint performa, and based on the magnitudes of deviation, the surgery of choice was chosen, and post-surgery, they were on regular follow-up. Now, case 1 is a 24-year-old male complaining of outward deviation of both eyes, right eye more than left eye since birth, and on post-occlusion, we found a very significant A-pattern exotropia of approximately 40 prism diopters base in. He also presented with both eye superior oblique overaction, as we can see in the 9 cases, and associated with the DVD, which was associated with extorsion and abduction of the deviated eye with fine latent nystagmus. To manage this case, he underwent a left eye lateral rectus resection with medial rectus resection and its muscle transplantation, and both eye superior oblique posterior retinotomy, as we can see in this video. Post-operatively, a very good correction of DVD was seen, a collapse of the A pattern was seen, and also a correction of the superior oblique overaction was seen. Case 2 is a 20-year-old female who had minor decrease of all the 3 components of HELVESTON syndrome, and therefore a singular surgery of the horizontal muscles comprising of an LR resection with its half-width infraplacement and a medial rectus resection was done, following which we saw a very good outcome of the surgery. The third case is of a 20-year-old female who had, along with a 20 prism diopter basin of A pattern, moderate degrees of superior oblique overaction and moderate amounts of DVD, and for which she underwent a lateral rectus resection with its half-width infraplacement and a Faden's operation of the superior rectus. Post-operatively, we have seen reduction in all the 3 components of HELVESTON syndrome. The fourth case is of an 18-year-old female who presented with a 15 prism diopters of A pattern of exotropia and who had a very large angle of dissociated vertical deviation, and therefore, first initially she went on for a lateral rectus resection with infraplacement and with medial rectus resection with muscle transplantation, and in the future we will be posting her for a posterior retinotomy of superior oblique both eyes. Post-operatively, we have only seen a collapse of the A pattern. Therefore, in this current study, we report the surgical outcomes of 4 cases of HELVESTON syndrome. While there is no particular dictum, but each surgical management was customized to the patient's degree of A pattern, the superior oblique overaction, and the DVD. 3 out of 4 cases underwent multi-stage procedures to achieve the optimum outcome. Cases with larger magnitudes of deviation required combined surgeries. However, it can also be customized to increase the likelihood for a single surgery to provide positive outcomes, as we have seen in case 2. This is a summary of the 4 cases. We have seen that there is reduction in all the components of HELVESTON syndrome. However, there remain certain residuals, but I believe that in the light of the cosmetic outcome that the patient has achieved, these remain minimally significant. Therefore, to conclude in this present series, all the cases of HELVESTON syndrome following surgical procedures have shown optimum outcome, acceptable to them, and tailored to the magnitudes of deviation. With this, I conclude. Thank you very much. Thank you, ma'am.
What was the follow-up of your patients?
So we did a 1-week post-op day 1, 1 week, 3 week, 3 months, and on 6-month follow-up, sir.
And so for the DVD, what did you do? Just a Faden suture, or did you do a superior rectus resection also?
So I didn't understand. For DVD?
For your DVD,
yes, sir.
How did you manage your DVD in these cases?
So if the degree was between 10 to 20, so we went on for a Faden's operation. If it was more and associated with the superior oblique overaction, then PTSO was done, sir.
No, but it's HELVESTON, so it would be associated with superior oblique.
Yes, sir.
So,
So for moderate grades, we went on to do a fade-ins operation, but otherwise it was only PTSO, sir.
And what is your capacity as a presenter?
So I'm a postgraduate PGY2, sir.
Okay, and what is the criteria? How do you decide your anterior transposition of inferior oblique?
So inferior oblique, sir.
The dose, surgical dose.
So we will only do an inferior oblique when there is involvement, but in Helveston we don't.
No,
say
we are placing on the
anterior transposition
Yeah,
of anterior
yeah.
oblique, of inferior oblique is also done.
Where are you placing at the level of inferior rectus or +1 or +2 or +3 or -1?
So I'm not sure, sir. I don't
Just
know.
go for it.
Yes, sir.
There is there. Okay. And
Okay, sir.
for DVD, even with the patterns and inferior oblique is very good muscle and give very good results and by very forgiving muscles. So there's a lot of there. Just go through the literature and you'll find.
Okay, sir. Thank you, sir.
Dr. Pragya, nice presentation.
Thank
Good
you,
that
sir.
you have included a lot of videos and all pre and post-op pictures.
Thank you,
Otherwise,
sir.
nice presentation.
Thank you, sir.
And one thing more, that once try to we are presenting the science. So be on scientific, more tables, less words, and more picture. Or if you can include the video of the important procedure, that is more like contributing for
I
more
agree,
science.
sir. Yes, sir. Thank you, sir.